Putting aside those hiccups at the start of the school year, Colorado remains one of the bright spots in the battle against COVID-19. But some other states are still struggling through massive infection rates and deaths. The Texas-Mexico border remains one of the biggest hot spots, prompting FEMA to recently send in a special medical task force for support. Among those going, an Army Reserve nurse from Fort Carson. Tonight, her story, fighting COVID-19 on the front lines. Long before COVID-19, the Army was already an important partner in providing health care along the Texas border. For 2 weeks every year, soldiers from units around the country provide basic screenings and services that these families simply couldn't afford otherwise. The entire Rio Grande Valley region became a hotspot in early July, and hospital beds are still in short supply. Monday alone, Hidalgo County reported 675 new cases and 10 deaths. On July 27th, a medical task force arrived here. 85 Army reservists, including First Lieutenant Michelle Kaplan, a critical care nurse who normally works as a civilian at Evans Army Community Hospital at Fort Carson.
These patients are really sick and they need great ICU care.
When Kaplan arrived at DHR in the city of Edinburgh, she found the ICU completely filled with patients in a variety of conditions.
We're assigned a patient, and that patient can be awake and talking, or they can be intubated, sedated, and very sick. So you kind of have to keep an open mind, plan for anything, and go from there.
Along with learning the virus itself, Kaplan has also had to learn her patients' culture. Stay-at-home orders are still in effect here, and the streets are largely empty, yet the cases are still coming in, partially because families here are often large, yet crowded together due to limited income.
Families live in multi-generational households, so that puts them at greater risk for being exposed to COVID, especially if one of their family members has been exposed already.
Kaplan says the experience has been overwhelming and humbling at the same time, and just the type of adventure she expected when deciding to become a nurse in the Army Reserves.
I have skills and I have the knowledge, and I am super proud and humbled that I was able to be here and share my experience with all the staff that need it most. And the really unique part of all of this is that we get to do it here on American soil. I'm very proud, I'm very honored to be here and to fight the fight for as long as we need to.
Lieutenant Kaplan says over the past few weeks, the number of cases, while still high, has leveled off, and that allows them to provide more detailed care to each patient, increasing their chances of survival. However, it could still be weeks or even longer before she and the rest of her unit are allowed to return home.